Blood in your pee could be a sign of cancer, even if it is just the once. Finding it early makes it more treatable, so don't ignore it. Tell your doctor. Be clear on cancer.
My name is Jonathan Makanjuola. I'm a consultant urologist at King's College Hospital, and I see predominantly patients that have bladder and kidney cancer. This is a Public Health England campaign targeted mainly people of black and ethnic minority and faith groups. And the main message of this campaign is look before you flush the toilet. We're really trying to emphasize the symptoms of bladder and kidney cancer and telling people to, if they notice blood in their urine, to go to their GP straight away, even if it's just the once. So the symptoms and signs to look out for bladder and kidney cancer, predominantly with this campaign, is blood in your urine. In women, you can have recurrent bladder infections, which are quite common, but we're saying that if you have a bladder infection and it's treated, but despite the antibiotics, you're still getting blood in the urine, or you're getting recurrent bladder infections, go and see your GP. And in men, if you notice blood, definitely go and get checked out. But the bottom line, we're not trying to confuse people. We just say, if you notice blood in your urine and you're not happy about the symptoms or not quite sure, go to your GP and get checked. It's a very simple urine test. And then if it does trigger fine blood, then we get referred to a specialist like me. So we've been to over 250 places of worship across the country in cities like Nottingham, Leicester. And we're really targeting faith groups because we know that in a lot of these groups, faith is very important to them. And we're teaming up with a lot of imams and pastors and vicars to try and get the message across. We know in some of these groups, delay in presentation can cause really bad outcomes basically. So we're saying if you notice blood in your urine, even if it's just the once, go and see your GP as soon as possible. We know in some faith groups there's a perception that God's in control of everything, and even if they have symptoms, they may not necessarily go and see their doctor because their life is preordained already and what will be will be. But what we're saying to them is, yes, God is important in your life, but equally it's important to get checked out if you have symptoms of blood in your urine very early, because like a lot of cancers, if picked up early, we can cure and treat it. If left too late, there may not be much we can do. So that's why we're really targeting faith groups to try and work with the ministers and the churches and different religious groups to say, if you notice the blood, go and get it checked out basically. In terms of the rates of new diagnosis, there are over 18,000 cases of bladder and kidney cancer last year and about 9,000 deaths. And that's still too many basically. So by this NHS England campaign, we're really just trying to push the word out about blood in the urine and getting people to, if they notice their symptoms, to get checked earlier to try and prevent some problems going forward.
Approximately 17,500 people will develop kidney or bladder cancer per year in the UK.
People from the black community we don't talk about cancer. We see cancer as a death sentence, really.
Cancer in Asian community, I think is seen as a big taboo. So the minute you mention cancer, people think, oh, wow,
Patients are often very embarrassed to come forward. They don't want to tell their friends or relatives or discuss it. They feel that perhaps something wrong that they've done is now the cause of their symptoms. They may visit a spiritualist rather than going directly to their GP. And not that that's a bad thing, but of course that may delay things.
So there's been quite a few studies from the US and the UK looking at that very question as to why ethnic minorities may present later. And we find that there may be cultural, religious or even language barriers in preventing people from going to seek intervention and going to see their GP. So by having this campaign that targets these groups, we can reach out to them and say, look, if you're having these symptoms, please go and see your GP and get things checked early. So in women, it's quite common to get urinary tract infections or bladder infections. And they can mimic bladder cancer, so it can be really difficult to try and challenging to try and decide which one's which. But what we say is, if you have recurrent bladder infections, or bladder infections that are treated appropriately with antibiotics, but you still get blood in the urine, then that will definitely warrant a referral across. In men, any blood in the urine is not normal, and that definitely needs to get checked out.
I went to my GP. I was asked to provide a urine sample.
They did my urine test, and I think they realized very quickly that it was something very serious.
You can't just sort of ignore it, so I felt that if I talked about it, then I've got other people there to support me.
I told my immediate family straight away and friends as well, and they were very, very supportive. And to be honest, I could not have managed without all their support. For a year or so I had the treatment and it has worked for me and cancer hasn't returned.
I work in South London, a very diverse population. We do see many patients that are unfortunately been diagnosed with bladder and kidney cancer. I had a few patients where, especially the men, where they decide not to seek medical attention, and it's until that things are really at an advanced stage or they're being nagged from their partners, that's when we find that they go and seek intervention. So we're really saying, men and women, if you notice blood in your urine, even if it's just the once, go and see your GP and get checked out. That's the key take-home message of this campaign. There are challenging cases where people don't have symptoms until an advanced stage, but the vast majority will manifest in blood in the urine or recurrent bladder infections. Bladder cancer is one of those conditions where, because the bladder growth comes from inside the bladder, you will have some kind of problem which manifests earlier. With kidney cancer, absolutely. A lot of the times we pick this up incidentally, so people may not have blood in their urine, but they have a scan for something else and we find a lump in the kidney. But again, we know that if things are detected early, they can be cured a lot sooner. So we're just trying to educate the public about symptoms of bladder and kidney cancer and what to do if you notice these symptoms we've discussed. You'd be surprised how many people don't actually look when they pass urine, especially in women, because it might be quite difficult to. So this campaign, which is really more targeted for the over 50s, because that's where the highest incidence of these cancers are saying look before you flush and just have a look and check. And since the campaign, I've had a lot of positive feedback from people, and people saying actually now, because of what you've said and what you advise, I always check my urine. And that's a positive thing, if anything. So there's lots of information on the internet and the World Wide Web. We're running a national radio campaign with adverts going out regularly on this very topic. There's also, if you go into the website and search Be Clear on Cancer, that's the NHS England website, and people can go and find a lot of information on symptoms of bladder and kidney cancer. There's running some videos about some cancer survivors who actually presented with blood in their urine and how and the journey they went through into those diagnosis and treatment from the faith and ethnic minority groups. And there's also a whole lot of information about how to get referred and what to do.
When I was referred to the urology team, the decision was that they would remove my bladder. So I had the operation and I was really glad that I did that. It saved my life and everything's fine now.
After the surgery, I felt relieved. I now look forward to the future.
We know that if cancer of the bladder and cancer of the kidney are detected early, then the treatments are very effective.
If any patients notice blood in their urine, even if it is just the one time, please discuss this with your GP straight away, don't delay.